In this week's Wellness Wednesday, we continue our focus on American Heart Health Month, and we are delighted to have with us cardiac surgeon Dr. David Towson. How are you doing?
I'm doing very well, thank you, very well.
And thank you so much for joining us this afternoon. So you are a cardiac surgeon. How long have you been doing this?
Oh, so I started since med school. I finished med school in 1990. So trained for 7 years in Jackson, and then I've been here since 1997. So it's been a long road.
I was going to say, you've seen some changes over the years,
We've
too.
seen a lot of changes. The stuff we do now is not even close to the stuff we used to do 20 years ago.
Now, when it comes to heart health, how important is it for people to maintain their healthy heart before, because they don't want to come to you?
Yeah, nobody wants to see me, unfortunately. or the cardiologist in the cath lab. I mean, I think, a lot of heart disease is genetic. You can't help that, but, cholesterol and high blood pressure and exercise and keeping in shape are things that you can help lower your risk. Won't take it away completely if you have strong genetics, but you certainly can lower your risk for stuff.
Now, when it comes to your specialty, you actually brought in for us 2 models here. Tell us a little bit about what this is. This is something that you actually specialize in.
So it is. So this is a mitral clip. And, when I started here, literally almost 28 years ago, if you had mitral valve disease, your only option was open surgery. You had no other option. And unfortunately, 27 years ago, we did not repair a lot of valves. Most valves just got replaced. And patients really did not do that well. Step forward 15 years, we started doing a lot of repairs, and patients started having a lot better outcomes, living a lot longer, doing well with those. Step forward more years, you get into a group of populations that just don't have any options. And those are patients who are just really sick from a heart standpoint. Their heart function is very poor. They've had a lot of damage over the years from heart attacks, but they have valves which are leaking. And this is the mitral valve, which is one of the most important valves in the heart. The mitral and aortic valve are on the left side of the heart, which is where all your blood pressure comes from. So you can tell if those valves go bad, you can have a lot of issues. But one of the problems with people who have dilated hearts or very sick hearts is this valve can start leaking severely. The gold standard is still repairing it. The gold standard is going to the operating room, repairing it surgically, or even replacing it. But we have a lot of patients now that we see on a weekly. I saw 2 today in clinic that need this exact procedure. Their heart function is poor, and what I'm trying to do is buy them years of life. I'm trying to buy them quality of life. People who have a bad heart function and are doing very poorly may not live 5 more years, but I'd like for them to live 5 more years where they can walk around. I'd like for them to live 5 more years where they can get around and be functional and feel like they have some form of life. And what this does, by putting this clip on these valves, we can stop the amount of regurgitation that valve's having. Because when your heart valve regurgitates, you get volume overloaded, you start swelling, you can't breathe. Because the lungs are having to do everything twice, and heart's pumping the same amount of blood twice. And so it just wears the heart down. Now,
we are running out of time. If you can quickly tell us about this, and then, of course, the benefits, too.
So this is aortic valve, and we started doing these in 2012. We've done almost 900, but these valves right here are put in more in the older population, 70+ year old. But these are valves we can put in through the legs. We can go in through the legs, have somebody come in one day, put this valve in, they go home the next morning. I'd say 98, and we've done patients as old as 97, 98 years old. And it's not about how old you are, it's about what kind of function you are, whether you have a life expectancy of more of a year or so. So we've got a lot of people say, well, I'm too old. Well, you're 90, you're not too old. If you're still functioning, you're still doing well, you're not too old. And so the hardest thing about both of these procedures, if people have in their mind sometimes, well, I'm just too old or I'm too sick, and nobody's ever really looked at them from a comprehensive standpoint. And we've got a great group of cardiologists. They look at all these patients and us too, so it's a collaborative group.
Collaborative group, and definitely a collaborative effort to be able to prolong the life of a lot of the people here.
Absolutely.
In North Mississippi. Well, thank you so much for
You're
all
welcome.
that you do. Well, airline schedules